So we are going to go ahead and get started. Hopefully everybody can hear us and there's no issues. Okay, good. So we're just going to start with some brief introductions and then really just leave it open to you guys to ask whatever questions you guys have. So I'm Connie. I am a third-year surgery resident here. I did do the internship here in the hospital that we offer before starting my residency. And I also had the luxury of doing 2 other private practice internships prior to coming to here. And I'll be your guys's person for questions for our hospital internship.
And my name is Sam. I was a 2018-2019 ambulatory intern and a current ambulatory associate. So I'll be able to answer your questions regarding the ambulatory internship.
So I guess I can start with like a brief overview of the hospital internship. This practice is primarily a referral practice. So the majority of horses that we see here have already been seen by an ambulatory veterinarian before coming. So quite specialized. We do offer elective and emergency surgeries. We have 4 boarded surgeons and 1 associate surgeon. And we also have 1 boarded internal medicine specialist that has quite high of a caseload here in hospital. So we do have a healthy variety of cases that we see. In addition to both surgery and medicine specialists, we have Dr. Dennis Brooks, who's an ophthalmology specialist, especially with equine ophthalmology, that comes at least once a week. For us to see cases with him as well.
Right. And the cases on ambulatory in Ocala, there's a wide range of types of equine practice we see. So we have a lot of sports medicine, 3-day eventers, dressage, hunter jumpers. We also have Western pleasure. There's a good amount of thoroughbred, racetrack and breeding, as well as our clients that just have a couple horses in their backyard. So the ambulatory internship is great because we do a little bit of everything. Yeah.
Does anybody have any questions?
Where are you guys from? And could you talk about your transition from where you're from to Ocala?
Yeah, so I grew up in Oklahoma and I did all my schooling in Oklahoma. I did undergrad and vet school there. I did my first private practice internship also in Oklahoma. Decided I wanted to pursue a residency and had a hard time getting accepted into a program. So my second internship was at Chino Valley Equine Hospital. And my first one was at Oak Ridge Equine Hospital. And then ended up here in Ocala, moving from California all the way over to Florida for the internship, and then stayed on and started the residency.
And I'm from Illinois. I did my undergrad at Iowa State, and then I went to vet school at the University of Illinois. And then right after vet school, I did the ambulatory internship in Ocala. And I thought it was a great transition. Ocala is a very horsey town, so it's I think it's great if you're an equine person.
Yeah.
Thanks for the question, Chelsea.
I have a question.
Go ahead.
So both of you not being from Florida, I guess what drew you to Peterson and Smith as opposed to all the other practices?
That's a good question. Ocala does have several referral type centers. This was the practice that I felt drawn to. I think just for the variety that they offer, and then also I was able to visit as an extern and just getting to know the people here. And it is, you know, when I first visited now 3, 4, 5 years ago. It's pretty much the same crowd that's still here today. So I think that's kind of what did it for me.
Yeah, I had a similar experience. I came as a student 2 separate occasions, and I just loved working with the veterinarians here. Everyone was a really great teacher, very welcoming, and I rode with one of the ambulatory veterinarians, and just seeing their practice and how we go from injecting hocks on a hunter jumper to a colic, to someone's backyard pony. Was kind of the type of practice I wanted to do long term. So I wanted to get that kind of experience here.
Can you guys speak to the externship that you did when you were students?
Mm-hmm. I guess, do you mean just like our experience here?
Yeah, and like what that looks like. Like when you're an extern, do you stay in the hospital or do you have to pick between that and ambulatory? Like how does that work?
It's kind of a pick what you like to do. When I was an extern as a 4th year veterinary student, I was here about 2 weeks, and I split it pretty evenly between the hospital and the road. Because at that time I wasn't sure if I wanted to be a road vet or pursue, a specialized area. So I did about 50-50, but you can really tailor it to your own interests. We do have some externs that stay primarily in the hospital, or some that spend different days with different doctors on our fleet. We have a pretty large ambulatory fleet, and everybody has their own kind of niche with that. So you can really have a different day every day when you visit.
Yeah, and as far as in the hospital, just along those lines, it is mostly the extern's preference whether you want to be in the hospital or if you want to go on the road. And in the hospital, pretty much everything that we do here is at this central location. So you're free to get involved in watching surgeries, whatever appointments there are, whatever procedures that are going on throughout the day. And then also, if you're interested in coming in for emergencies, we also are pretty good at always calling the externs in to come help out all night with different emergencies. So, yeah.
Cool, thanks.
Do you guys have any information about the reproduction internship residency program?
So we do have that second location. We have a main location in Ocala, Florida, where we have like our surgery suites and whatnot. And then we have a second location in Summerfield, Florida. That's not too far from here, about 20-30 minutes. And they specialize in reproduction. Neither of us have done the internship there, unfortunately, but if you're interested, you can send us your email. We can put you in contact with the current intern there. But that's also a great experience. As ambulatory and hospital interns, you do visit the ERC, is what we call it, where we do kind of practice labs out there.
And they are involved. We have a very large repro mare herd that our clients can rent out the uses, and we help with the reproductive services for those mares. We also will offer reproductive services on client-owned mares that may or may not stay at that facility. And the level of like reproductive technology that they use is from very basic to very, very advanced. They are actually doing a lot of really cool work there. Being at that location and doing that internship, it is like a whole different world compared to what we do here. They, of course, take care of all of our mares there and can treat colics and treat lacerations and that sort of thing. But the probably 98% of the time, they're just focused on reproduction and taking care of the foals that they'll foal out in the spring.
Okay, thank you.
Thank you for the question.
Hi, would you mind talking about a typical day in the life of an intern, both as a hospital intern, as an ambulatory intern?
That's a good question. So with the hospital interns, our day starts at either 7 or 7:30 typically. During the week, we actually have 2 mornings where we get together with the hospital surgery residents, both our internists and all of our surgeons. And it is a very focused time where we get to one day bring up journal articles where interns and residents will present different papers and we'll discuss them. And then one other day of the week, it's called topic rounds, where the interns get to select a topic for everybody to discuss. It is a really neat and very privileged thing that we do here. Is just definitely taken seriously by the clinicians here, and to be able to offer that one-on-one time pretty much of giving their advice. And we've got surgeons and interns who've been here for years and years and years, and they are just a wealth of information. So that starts our day a little bit earlier, twice a week. But other than that, our main focus at the beginning of the day is checking on all of the hospitalized patients and making sure everybody has done well overnight. We do have an intern who rotates on nights, and then the other interns are on during the day. So we do have 24-hour care with the veterinarian here. And then the bulk of our surgeries and appointments are going to be during the morning and early afternoon. So interns will help out either with surgeries or helping out with appointments and whatever procedures happen to be going on. And then we have a rounds at the end of the day where we go stall side and talk about all the cases that we have in the hospital, discussing what happened that day, what the plan is going to be going forward, and also just discussing the cases in general.
And then the ambulatory internship, it kind of changes as you grow with it. The first 6 to 8 weeks, the interns primarily ride with our partner veterinarians and the associates, kind of learning where the different farms are, and then kind of techniques and methods. We practice tubing and giving injections with another veterinarian there. And then the part that I loved about the ambulatory internship here is you get your own vet truck that is stocked, and you take that with you basically every day, the whole year you're with us. And then you go out and we'll give you calls kind of tailored on your skill level. And then you go out and you're the primary vet on those calls. So it's a great learning experience, and you really become an independent veterinarian by the end of your years here. We usually have 2 ambulatory interns and 3?
Yeah, 3 or
3 in the
4.
hospital.
I guess I can talk more about the hospital interns, how they rotate. It is kind of on a week to 2 week basis, but you'll rotate through either assisting one of our surgeons or assisting our internists while you're on days. And then you'll rotate to nights, and the night shift is for 2 weeks. And so your responsibility there is to just take care of all the patients in the hospital during that time period. If emergencies come in, you'll assist with those, and just making sure that if changes happen in our critical patients, that a veterinarian is right there to help take care of things right away. During the initial few months of the internship, our interns are trained to do anesthesia, and then once they've had enough training and are approved, then it won't be their primary responsibility. And we do have a couple of very trained technicians who do the majority of anesthesia at this hospital.
And then I guess what popped in my mind was, as an intern with us, you spend a week in Kentucky with 2 of our doctors during the Cleveland sale, and that is a really cool experience if you haven't gone. And at the sale, you'll be with the senior veterinarian reading out x-rays and then retaking x-rays and scoping horses as our clients need that. And it's a really cool experience. And then here in Ocala, we are the vets at a couple of the local horse shows, and that's also a really cool experience that it's great to have that as an intern. So when you're looking for associate positions, you'll have had that experience and guided experience already.
What is the on-call schedule like?
That's a good question. So for the hospital, how our on-call works is we do have 2 people on call every night. The first person is considered primary, the second person is secondary. So that's just the primary and the assistant veterinarians that would come in for every emergency we have. And we do already have an intern here. So for every emergency, we have at least 3 veterinarians there to help assist. As far as the time that our interns are on call, how it's typically shared is also with our residents. So for instance, this year we have a first-year resident and she is taking 50% of the secondary on call. So the other 50% is shared between our interns and then also other residents. So interns will typically be on maybe 1 weekend every 4 to 5 weeks, and then 1 or 2 nights a week is how it'll work out.
And then the ambulatory internship is a little different. Each intern gets their day off from midnight, let's say on Wednesday, until the next morning, 7:30. But then you are on call the other days besides your day off.
Are most of the hospital interns more interested in a surgery residency because you do have 3 in-house surgeons, or is there still value in, like, if you're interested in internal medicine residency, is that a little harder since you only have 1 internist?
That's a good question. I really like that question. I feel like, I guess to me, it seems most equine interested students that are doing internships, I feel like the majority of them are interested in surgery. And so that tends to be a big population of the interns going into an internship at a referral hospital like this. I think what's really unique about this internship opportunity is it's kind of split 3 ways, and it's about 1/3 of your time you'll spend with a surgeon, 1/3 will be with an internist, and 1/3 of it will be on nights where you're helping out with all of the cases. So there is a lot of variability with it, and I think despite not even just with the experience of the surgeons here, but with how enjoyable they are to work with and are interested in teaching the interns and everything. But Dr. Carol Clark is also a phenomenal internist, and she is phenomenal with the interns and teaching, and she is involved in every single medicine case that comes through this hospital. So you get a lot of specialized knowledge in both medicine and surgery. So I think that an intern that isn't sure, that like wants to specialize or maybe doesn't, but isn't sure if they like medicine or surgery more, that they get a really good variety of experience here.
Thanks.
And then along with the internship, we do have a series of wet labs that I mentioned before are held at the ERC. And these are all, well, for the ambulatory intern, it's usually, most of them are held during those 6 weeks you're riding with the partners. So it's kind of combined with all the learning experience before you're set out on the road by yourself. And some of these include, just generally passing an nasogastric tube, because a lot of students, you get a wide range of what schools allow, and just like caseload, what they've had experience doing. I know we'll do transtracheal washes and BALs, passing or placing an SPL,
Joint injection,
X-rays,
epidurals.
Placing over the wire catheters, kind of everything. And I loved the wet labs as an intern. So it's always great. The hospital doctors and ambulatory doctors help with that. So even as like an ambulatory intern, you get to work with some of the hospital doctors and how they do these procedures and kind of vice versa.
What are some of the main skills you think you gained from your internships?
That's a good question. I chose to do an internship and seeking to do a residency, and that's just the step that you have to take. But I think what I mostly gained from it is definitely learning your skills, which I think in most veterinary school programs, having those hands-on experiences as a student are pretty lacking, and even in the educational part of it. There's definitely a lot of topics for equine medicine and surgery that as a vet you will deal with every day that you got like maybe one lecture on when you're in school. So I think the internship really helps with that, to kind of hone in on all of those skills that you are going to be using every day. I think one other really good thing that I have gotten from it is kind of getting to be the fly on the wall with client communication. That's another topic that I feel like doesn't get brought up as much with vet school, and getting that experience. And now as a resident where I get to start taking my own cases, I just have all of these conversations that are in my head, and I can hear my mentors as I'm speaking with clients. And I think that has been a huge benefit to doing an internship, is because you get to hear all those conversations and how people perceive problems and how to talk to clients about it. Because if you can't talk to clients about it, no matter how good of a veterinarian you are, you're going to have trouble if you don't get that communication done well. So that's something that I think a lot of us don't really think about, but it's been a huge help to me during my internship to learn how to communicate with clients well.
Yeah, I feel like the ambulatory internship, it was kind of like, what skill didn't I improve during that first year? Coming out of school, I tubed, at the AAP labs, but it wasn't something I started the internship being confident with. And that was just something that within the first 2 to 4 weeks here, I was like, tubing a horse was not a big deal, and I felt really comfortable doing that. Similar with all your road emergencies. So assessing and handling lacerations, chokes, kind of everything really. And it's, I guess, the unique part of the ambulatory internship here is, you'll see eye emergencies in the field, and then we have direct contact with Dr. Brooks in the hospital and Dr. Clark. They're just a phone call away, and we consult as road veterinarians with the hospital veterinarians all the time. And I think that's a really unique and valuable experience that you can get here.
My question might be a little off topic, but you both mentioned that you could go up to Keeneland and work the sales. Have either of you experienced that? And then I'm curious to see what your opinion in the difference between Lexington area, equine, and Ocala. I have a lot of experience in the Lexington area, but I'm interested to see how that varies.
Yeah, I have been to Keeneland as an intern. I guess the sales are all kind of similar, except for kind of like clientele and horses that are actually there. Keeneland's a huge sale because we do have OBS, the Ocala breeder sale down the road, and we do similar things locally with the X-ray scopes, reading X-rays. I personally haven't spent a ton of time in Kentucky with like the Kentucky hospitals, so I can't really compare to that. I love Ocala and the
Yeah, and it definitely makes sense that there's going to be, it's horse is the horse, but there is going to be those slight differences. So I was just interested to see if you guys felt like, you liked Ocala a little bit better, or Lexington, or just any kind of your personal insight.
I mean, I would say I like Ocala better because it doesn't snow. Being a veterinarian working outside and driving every day, all day, I don't miss the snow. But
yeah, and I haven't spent a ton of time in Lexington. I mean, I think both towns are on the smaller side, but I guess speaking to Ocala, I think the social life is there's definitely there's things to do, and even in the time that I've lived here, there's been breweries opening up, there's bars, and there definitely is a good solid group of younger people here that like to get together and go to do to different things. Other thing that the area offers is, I mean, Florida, if you've never been to Florida, it's really hot most of the time. So be ready to sweat, but air conditioning is usually good somewhere that you can find quickly. But there's a lot of like outdoor things to do. Going to the beach, you can drive in either direction, and in like an hour and a half, you'll be on a beach. And there's springs in the area. There's a lot of stuff to do in your downtime that's pretty neat and pretty unique to this area. But hopefully that kind of answers your question.
No, yeah, absolutely. Thanks so much.
I've got a question. What are the typical emergencies that you see at the hospital or in the field?
That's a good question. I think probably the majority of emergencies we see are colics, and it can be anything from a mild colic that the owner or trainer just didn't want to stay up all night keeping an eye on, to like a brood mare that has a colon volvulus and we can't even examine her because she's laying down and rolling, and it's pretty much walking him straight to the surgery suite. Beyond that, we see lacerations, just advanced medicine cases. We see pneumonias, fractured legs, snake bites. These are just two of the emergencies that we saw this weekend. But there's definitely a big variety of them.
yeah, I would say it's similar. See a bunch of colics that range from minor to severe. We're sending them here. Chokes, lacerations, little eye ulcers to very severe melting eye ulcers or abscesses. We see a ton of summer sore wounds down here, so it's a lot of long-term like wound management in the field.
Yeah, in the springtime we see a lot of babies.
Yeah, babies.
Yeah, here in the hospital we are pretty much averaging over 100 foals that are referral sick foals that we'll see over the breeding foaling season, so that keeps us busy in the spring. Dystocias.
What kind of horses do you mostly see as far as like performance horses, race horses, rodeo, western? Like, I'm just curious what you mostly are working on.
Yeah. So I think in this area, probably the majority would be thoroughbreds, racing thoroughbreds. And we do see a fair number of eventers, not so many quarter horses. They kind of come and go, and some of it can be seasonal, and it depends on what shows are in town. Like, definitely we'll see a difference in the type of horses that we see here, but we do see I think a huge variety.
Yeah, I feel like it's a huge variety. Can be seasonal, and then I feel like there is a niche of like minis and donkeys out here too.
Yeah.
That we see a lot on the road.
And we do have a lot of large clients that have a lot of horses, and you can kind of get the experience of where a horse is sent in and the owner doesn't know anything about horses, but they have this high dollar trainer that takes care of everything for them, and we can have like unlimited budget to do whatever we want with the horse, all the way down to just somebody in their backyard pet, and maybe more limited funds. Certainly not always, but we definitely see the whole spectrum of our clientele as well.
And another question, as far as sports medicine, do you do a lot of sports medicine related things, like, you know, your hock injections and all of that with, I'm sure, the race horses? I'm used to like more on the barrel horse side, but I'm sure a lot of it is similar. How much experience do you get with that?
I think here in hospital, so one of our boarded surgeons, he also is double boarded into sports medicine. So we have him here to take complicated lameness cases or whatever it may be. We do offer bone scans here, and diagnostic wise for sports injuries, we pretty much have everything that you could look for in treating them and diagnosing them. So you get a ton of experience with that. I think that this area is kind of unique in the aspect that the majority of the ambulatory veterinarians, they do the majority of lamenesses, and which progressing to if there's injections or whatever. Whereas in some areas, I think that kind of referral like hospitals can also serve as that service to their clients. But so I guess what I'm saying is, like, horses coming into the hospital that just need like routine or whatever maintenance hock injections, like a lot of that is done in the ambulatory setting. So here in hospital, it's mostly either more severe cases, more complicated cases, so that sort of thing. Yeah.
When you guys did your externship there, did you know that was where you wanted to intern, or did you know after your experience there, or how did that work?
When I visited as an extern, I really enjoyed my time here. I enjoyed the people here, and with my primary goal of getting into a residency, this practice was very high on my list for how much I liked the residency, and being in my final year of it, I can still say that holds true, that, coming as an intern to get to continue on for this residency program I really think it's one of the best ones in the country. Of course, I'm biased, and this is the program that I'm in, but I think that it's going to set me up to be able to go out of here and do anything. In my experience with not only all the boarded surgeons here that have long careers behind them, but also with our internist, Carol Clark, and I think that you get that experience, kind of as an intern as well, and it's easy to see when you're coming to visit as an extern the wide variety of specialists that you'll get to be exposed to.
Yeah, I guess when I externed as a fourth year, I definitely, as I was visiting, I was hoping that I could do the internship here. The first time I visited, I was, I think, like a second year, like the summer before second year, so I was like too new to that world to really make a solid decision. But yeah, Peterson and Smith is where I always wanted to go.
Is there any other burning questions? We do have the information about salary. They also help out with housing and covering insurance as well. So the hospital interns, the salary ends up being $33,000. It has been increased compared to previous years, so that's nice to see. And as far as like finding living around here, there's a lot of different, definitely apartment complexes that are an option, and also rent houses as well. And I think it's a very affordable place to live, so that's nice. Sometimes unfortunately really nice practices are in very expensive areas to live, and it makes it hard on the intern salary, but luckily in this area that's not the case.
I have a question. What do you think makes for a successful internship there?
Okay.
So to be like a successful ambulatory intern, I feel like you have to have a degree of self-motivation, because once you get released on your own, you're really in charge of creating your own schedule. And you get a lot of independence. With, of course, like, we're always a phone call away. We support you guys. And we meet you out there if you need help and whatnot. So don't feel like it's completely totally out on your own. But
yeah, and I guess in the hospital, I mean, being a go-getter is always good.
Yeah, that too.
Internships are hard no matter where you're at. I mean, I don't think an easy internship really exists. So being ready to kind of put forth the effort and the time, and really take advantage of the internship and trying to learn as much as you can. I think the year really does go by quickly by the end of it. And then also, especially here in the hospital, on the road too, but just like get along ability, I think it's one of my favorite words. I mean, there's definitely, we're very well staffed in the hospital. We have a pretty large technician staff to help take care of all these intensive patients. So being able to work well, especially in intense situations as they're going to come, is a good thing. But yeah. I mean, we definitely, starting as an intern, we don't expect you to know everything. We don't expect you to have experience doing everything. And that's fine. I mean, you just got to let us know where you're at and what you're comfortable with. And I think there definitely is a lot of flexibility. And, you know, we've had interns that are maybe more go-getters than others. And it definitely is easy to identify, and your experience definitely changes with that as well. I mean, if, your interest and how you're performing, and, you know, we'll just keep rolling with it and let you get as much experience that you feel comfortable doing and that we feel comfortable letting you do. So.
I think I missed the very beginning. I came in a little bit late, but what is it that you both are planning on doing after? And for somebody who wants to just do like general practice, ambulatory after school, do you recommend an internship like this? I'm sure it's very competitive here, but what are your recommendations?
I guess if you're looking for general practice, we have multiple internships. I did the ambulatory internship, and Connie did the surgery hospital internship. So if you're looking to do general practice, the ambulatory internship really sets you up to be a very good functional veterinarian with a wide range of cases, from emergencies to general care. So I would say the ambulatory internship is great for that.
And then for the hospital internship, I think it is going to give you a similar variety of cases. I mean, a lot of cases will be the same. We maybe see more commonly more complicated cases. But in the hospital, you do get, this practice, the majority of the cases that we see in hospital have already been seen by a veterinarian. And so you're not getting that like direct primary, you're the case decision maker on how this case is going to go from the very beginning. But in the hospital, you get to know about all those things. So if Sam is out seeing an eye case that has an ulcer, and I'm in the hospital as an intern, I get to hear everything that she did. And so you get, I think, maybe a little bit more advanced exposure to what procedures can be done, which if going out into general practice, you're not going to be scrubbing into an arthroscopy and just a general practice unless your facility is set up for that. But you get to see it, and you get to have that experience of doing it and know what can go wrong afterwards with the recovery period. So yeah, hopefully that answers your question.
Yes, thank you.
Are there any other questions? And we're happy to answer questions about whatever, life, deciding what to do, anything. Well, I guess that's it.
Yeah. Thanks for coming and bringing a lot of good questions.
Yeah, thank you guys. You definitely can reach us easily through our Facebook page, and they can get your questions if you have more questions for the hospital or for the ambulatory service. We're definitely easy to get a hold of, so feel free to do that as well. Thanks again.